Let's talk about inflamed gums. First of all, what are inflamed gums? Well, just like if you were to cut your leg or your arm, right? You cut your arm there, what happens? It swells up, gets hard, the blood rushes to the area, and what it does is it's a really intentional trying to heal that cut, stop the infection, let the body grow back to its normal self. That's exactly what inflamed gums try to achieve, right? There's some kind of stress there, some kind of chemical stress, or some kind of trauma type of stress, or chemical stress. You burn yourself with hot pizza, a chemical you drank or ingested burnt that area. Or more commonly is a chemical stress in terms of a bacteria producing all these toxins, right? So your gums inflame. The problem with that is that your body, toothbrush, floss can't get rid of it. It's stuck to your tooth or underneath the gums. And the inflammation goes from an acute status of a short period of time to chronic, long lasting. And when it's long lasting, that's when all the bad stuff happens. Your bone starts to melt, gums get really red and swell. They can be tender, they can hurt. Bad breath can actually start to happen. So gum inflammation in the short term is okay. That's how the body heals. Long term, that's when all the dire consequences that you hear about with the long-term health effects, not only in the mouth but the body, can really take effect. So if you have inflamed gums or you feel that they're trying to become inflamed, listen, come see me, go see a dentist, and to make sure you take care of them right away. It's for your own health.